I learned about hyperbaric therapy when I was in medical school. I grew up very outside the box of medicine. There was this myriad of things that was being used for outside the hospital in the alternative and wellness space. We're seeing fantastic improvements in people that shouldn't have improvements, and the people that the conventional system had given up on, like people with traumatic brain injuries or people with strokes or people with mild cognitive impairment or dementia or chronic infections. So I saw this research that was happening after I learned about it in medical school, and then I created a practice. During that time, I realized that hyperbaric therapy is a fantastic technology. It's not if hyperbaric therapy will be helpful, it's really when it will be helpful for most people. And I do feel that most people will benefit from it at some point in their life. And I have also this sort of inclination that it may go the way of the Peloton bike in some ways, where you have a hyperbaric chamber in a lot of people's homes using it as a regular recovery technology. If I had my way, it would be next to your Peloton, like mine is downstairs in my basement. And you had it so you could use it in both contests like that.
Awesome. I'm live with my friend, Dr. Scott Sherr, a leading expert in the field of hyperbaric oxygen treatment and an integrative clinician. It's awesome to have you here today, Dr. Scott.
It's good to see you again, John. It's been too long, as we were talking about before we got on air here. So,
yes. Yeah, we connected back in 2015. So it's almost been 10 years, which is wild. And you've been doing a lot of interesting work at the forefront of hyperbaric oxygen treatment, which we'll get into, as well as other well-being practices. And I think maybe we could just start off talking about, before we get into HBOT, we were just talking about it offline on just overdoing the wellness stuff and how people can think about optimizing, but can also think about balance and recovery, and some of your thoughts there. And then let's get into HBOT.
yeah, I mean, I've done a lot of lectures over the years. And one of the main questions I would ask when I give a lecture would be, how many people here are taking supplements? And the types of lectures that I do, mostly health and wellness types of events and biohacking events and various types of conferences that I've done over the years, about 90% of people will typically raise their hand. And then I ask the follow-up question is, how many people in this audience have actually tested what they needed and are using supplements that are based on those tests and are monitoring those labs over the long term? Now, 5 years ago, it would be like 5% of the audience doing that. Now, about 5 years later, I'd say about 30 to 40% of the audience is actually doing some sort of testing to be able to at least understand what they're doing and why they're doing it, and then monitoring things over time. So I do think that's important. I think it's important that we understand that you don't want to just take supplements in general without having a good understanding of what some of your baseline levels may be before you start taking things. And so, I mean, there are certain supplements that you take that you don't measure, of course, like adaptogens and other things. But in general, for foundational health principles, I really do emphasize the need to optimize your foundation. And that's usually looking at a comprehensive set of labs, vitamins, minerals, nutrients, supplements that are related to what you need, optimizing gut health, optimizing hormonal health. So those things are the foundation for me. And I think what's happened over the last several years is that you have a lot of great podcasts out there now with a lot of great information, but the information is being given to you by people that are not clinicians. These are people that are usually doing things on their own. They may be researchers, and they'd be really fantastic researchers, and they have a lot of great knowledge to share. But when they talk about specific types of supplements to take, or specific supplements that have specific types of research, it's very difficult to take that information and to use that information personally without having a greater context of how you're using that information. And I think that's where people get in trouble over time, is that they start stacking things upon stacking things, whether it be supplements, cold therapy, hot therapy, any kind of hyperbaric oxygen therapy as well, and not really thinking about the context and how they're using it. And so the way I think about this is that you need a foundation for all your biohacking. You need your foundation. You don't want to be chasing every technology, every practice, every supplement out there. You want to see, what is your foundation? What is your base? And then from there, methodically looking at various types of tools and technologies and how they personally will affect you, not how a researcher tells you they may affect you when you talk about, stacking these things for anti-aging, or stacking these things for sleep, or stacking these things for sex, or whatever else in between. Because what I found is that people just get in trouble over time. And this is what you feel and see when you're a clinician and you're seeing people all the time, and you're getting the experiences from the bio individuality of everybody around you.
When it comes to supplements, what are do you have any thoughts around what are some supplements that everyone can take or are the most accessible? Everyone can benefit from them, whereas there are others that folks have to be a little bit more careful around and ensure that they're doing it based off of their test results or based off of their relationship with what their clinician is telling them they need.
Yeah, I mean, I think in the latter category, the major category there is going to be antioxidants, because in general, people think that we need more and more antioxidants in our body, in our supplement regimens, because we need more of them because we're already under lots of stress. But the problem is that taking too many antioxidants can have the opposite effect. It actually can create two things to happen. It can decrease your body's ability to make them, which would put you at more risk if you get an infection or if you have stress. And the second thing is that um, your body can actually change from using them from antioxidants to some of them actually becoming pro-oxidant, or actually pro-inflammatory themselves. So we know this is not a good thing, and especially around like exercise or other types of uh, performance like things when you're doing what's called hormetic stress, when you're trying to stress the system. If you're taking too many antioxidants, that can actually neutralize the benefit of having the stress itself. The antioxidants may be a detriment to that. On the other side of things, like what can everybody take? That's always a good question. I don't have a great specific answer for you. I'd say in general, most people are going to be B vitamin deficient, and so I have people. Most of my clients that I work with, I measure levels, but usually on some sort of B vitamin. In general, like a B complex, typically activated B vitamins, because those are more easily absorbed into the system. Most people also will benefit from some sort of gut specific types of interventions, whether it be probiotics, prebiotics, postbiotics, or something like that in between. It kind of depends on symptomatology, but that's typically important. Mineral supplementation can be helpful if people are not drinking mineral water. But in essence, I don't really do a whole lot in my practice without actually measuring what people need and understanding what they're deficient in, or what they're sufficient in or sufficient in, and then working on in that framework. And I have a framework that I use specifically. It's called Health Optimization Medicine. This is a nonprofit organization, actually, that's training doctors and practitioners on how to optimize health. And a colleague of mine, his name is Dr. Ted. He started it about 10 years ago, and we have a nonprofit that's educating doctors now. And I was trained in it in 2019. And so I have a concierge medical practice where I work with patients doing this optimized testing. And this all came out of my work in hyperbaric therapy, John, because I found out very quickly when I started in the hyperbaric field that if I put people into chambers too quickly, it may be a detriment to them, because when you're getting more oxygen in the system, which is what you do in a hyperbaric chamber, you're making more energy. But if your body can't make energy effectively, or it can't balance out the stress of being under a higher oxygen condition, the system is going to have potential areas of breakdown that you're going to see in patients.
Yeah, let's take a step back maybe. Well, first before I get in there, I'm just curious for my out of my own curiosity, my own habits. Omega 3s, is there something specific that you might test for to know if someone needs fish oil, or is that something that
Yeah.
could people could benefit from across the board?
This is something I typically will test for. I mean, it's nice to know what the balance is of omega 3, omega 6, and omega 9 in general. So, omega 3s are from fish, omega 6s are typically from seeds, or it can be from vegetable oils as well. But omega 6s are also in animal products. It just there's a balance between omega 3 and omega 6 specifically that you're looking for. In general, our Western diets are too high in omega 6 and too low in omega 3. But it's also not good to have too many omega 3s compared to omega 6s. Like, you need to have that balance. So I don't typically recommend people supplement with omega 3s, at least for long periods of time, without getting their levels checked. Omega 9s are from olive oil, and you have omega 7s, you have like these ratios. I mean, so it's nice to be able to do like a panel where you can get that done. But
Yeah.
in general, if you don't eat fish, you do, because for whatever reason you don't, it's probably a good idea to take some omega-3. But um, the risk over the long term is kind of what I was talking about before, is that too many omega-3s over time may cause inflammation if the ratio is not there between the omega-3 and the omega-6. And so that's why I try to test as much as I can with omegas.
Yeah. Yeah, it's difficult as someone who's health conscious and health minded. There's a benefit that comes along with being the CEO or the advocate for your own health in a system where of
Right.
healthcare where it's very reactive and you basically have to beg your primary care uh, provider in certain practices to like test for specific things. And then on the
Very
other
true.
hand, it's hard to find the functional doctor that you trust, and then a lot of the, companies that are coming out are not even really pairing you with a clinician, they're pairing you with a health coach or someone else who's also not a clinician, is probably listening to these podcasts, getting this information, doing the experiments on themselves, and then just recommending, what they learn, over these podcasts as well, so the system is sort of lacking this uh, more functional health providers that people can trust in order to make
Right.
these decisions more intelligently.
Yeah, I mean, I think that on the positive though, there are a lot of these newer systems out there where you can get a functional health coach, you can get more comprehensive laboratory testing. There's a number of places in LA, as you know. There's a number of places that are virtual as well that you can look at. And I mean, as you were alluding to right there though, John, you really do have to be your own, CEO of your own health. No, there's no doubt about it. But I think excuse me, the key is being methodical about it and not throwing a whole bunch of things at yourself at the same time. Because number one, if you feel great, you don't know what it was that made you feel great because you have 20 different things you just started. And number two, if you feel bad, you don't know what caused you to feel bad because you just started 20 different things at the same time. So I think if I was going to give any advice and people that were looking here would be just be methodical about your approach. Try to be laboratory driven and data driven as much as possible too, and those are your main ways of keeping yourself safe and having a good experience while you're on this process. I mean, I'm obviously an advocate for finding a health quarterback as well, where you're working with somebody that you trust and that you feel is really helping you, as you're really working through this together. But I do understand that's difficult for people to find, although it's getting less, I think, less difficult to find. I think that you have a lot more options. And I think what I found over the years is that once you can get a framework going, once you get a feel of how you can kind of work with your own system, your own laboratory values, and that people can kind of do a lot of this on their own over time. But I think initially it's good to have people that kind of help you establish that framework and establish how methodical you can be over a long period of time, so you can start adding in new technologies, adding new practices in. It doesn't have to be like everything has to be a huge deal. Like if you want to go do yoga tomorrow, go to yoga for God's sakes. But it's like, but if you're going to start thinking about doing like, I don't know, 10 weeks of cold therapy every day, is that a great idea to start off with? Probably maybe think about that, in the sense that one thing that you and I were just talking about beforehand is that I find the biggest issue that I have with people that I work with, and personally too, is I'm not immune to this, is your sympathetic and parasympathetic balance, right? The balance between your autonomic nervous system, your rest and digest, your relaxation nervous system, your parasympathetic, and your stress, fight or flight, your sympathetic nervous system. Most of us these days, don't matter really where you live anymore, are more sympathetic driven and dominant. And so if you're doing things in your day-to-day life that are always sympathetically driving you, like cold therapy, for example, that may not be a great idea because it's going to maybe burn you out a bunch of hormones that are related to your stress system because you're already stressed outside of going into the cold tub every day. Right. So these are the kinds of things to think about.
Yeah, I think, Dr. Molly Maloof, one thing that
Yes.
she
You
said.
introduced to me, her to me many, many,
Yeah,
many,
something
yes,
that she said that I
many, many
really
moons
liked
ago.
was, like, we all have a stress cup, and if your stress cup is already full, because of life and other things that are going on, you probably don't want to add to that stress cup because it's gonna overflow, but if that cup is, halfway full, then you might be able to add some of these different, practices and things in order to get to that threshold, um, because yeah, if you're already getting sick, for example, or you're sick, you probably don't want to add more and do like a cold plunge.
Yeah, adding more stress to the
Yeah.
system, right? So, I mean, there is good stress. Obviously, there's the good sympathetic stress, eustress as we call it. And so it's just a matter of understanding where you are at the moment. Like you said, I think the cup example is a good way to think about it in the sense if you're already to the brim and you're adding more stress, it could throw you over the edge and you can reach your threshold and that can be a problem
Yeah.
for sure.
Yeah. So
Yeah.
hyperbaric oxygen treatment, how did you originally even get into this world and what is it?
So the short story is that I learned about hyperbaric therapy when I was in medical school. I was in a trauma center and I saw it being used from some pretty gnarly kinds of things, severe infections, severe trauma, carbon monoxide poisoning. And I saw these amazing recoveries in patients, people that either were going to get all their limbs amputated, which can happen with these flesh-eating types of bacteria, back in the news many years ago, but they used to show pictures of people with their limbs getting chopped off or like ravaged by these infections. But hyperbaric therapy could actually prevent this from happening or significantly mitigate what needed to be amputated. And then I saw people that were on ventilators when they went into a hyperbaric chamber leave the hyperbaric chamber on their own 2 feet being extubated in the chamber actually because of something like carbon monoxide poisoning. So when I learned about it, it was in the context of me growing up very alternatively. My father's a chiropractor. I grew up very outside the box of medicine. I went to conventional medical school with the high minded idea of bridging the gap between the major chasm, really, between alternative and conventional healthcare. And hyperbaric therapy was this potential technology that could do that because there was all these conventional ways that we were using it in the hospital, but there was this myriad of things that was being used for outside the hospital in the alternative and wellness space. We're seeing fantastic improvements in people that shouldn't have improvements and the people that the conventional system had given up on, like people with traumatic brain injuries or people with strokes or people with mild cognitive impairment or dementia or chronic infections or in patients with autoimmune issues that couldn't get better. And so I saw this research that was happening after I learned about it in medical school. And then I created a practice and it's been over for about over 10 years now where I've been working in the hyperbaric field. And during that time, as we were alluding to before with supplements and things like that, I realized that hyperbaric therapy is a fantastic technology. It's not if hyperbaric therapy will be helpful, it's really when it will be helpful for most people. And I do feel that most people will benefit from it at some point in their life. And I have also this sort of inclination that it may go the way of the Peloton bike in some ways, where you have a hyperbaric chamber in a lot of people's homes, using it as a regular recovery technology. If I had my way, it would be next to your Peloton, like mine is downstairs in my basement. And you had it so you could use it in both contests like that. So, of course, we're going to have dogs during this podcast. I apologize for that.
Your dogs are doing
But
the
anyway,
hyperbaric right now?
just angry at somebody coming to the door,
It's okay.
probably. Um, anyway, all good. So hyperbaric therapy itself, so what is it? It is a combination of increased inspired oxygen and increased atmospheric pressure. And so we all know oxygen already. Oxygen is what we breathe in the air. It's only about 21% in the oxygen that we breathe, actually. Sorry, in the air that we breathe, there's 21% oxygen. There's the rest of it's mostly nitrogen. In cities like LA and others, there's more other pollutants in the air that you get to breathe on a regular basis. So that's why I live in the high mountains here in Colorado to avoid some of that. But in essence, 21% oxygen has a really great track record because it increases our oxygen levels effectively in our body. So if you ever put a pulse ox on your finger, a pulse oximeter, everybody knows these things now from COVID, usually measures about 96 to 100%. That is measuring how much oxygen is bound to your hemoglobin, which is on your red blood cells, the cells that carry oxygen from our lungs to the rest of our body to maintain our physiologic function. Now, oxygen is what's called the final electron acceptor in the mitochondria. So it helps you make ATP or our energy currency. If you don't have ATP, you can't make energy. And we know this very quickly. If you have an ischemic event, if you have a heart attack, if you have a stroke, if you have less oxygen getting to tissue, your tissue starts dying very quickly. So oxygen is extremely important. There's 21% oxygen in the air that we breathe. In a hyperbaric chamber, we can increase that up to 100% if we want to. But that's not the only thing. The thing is, though, within that context is that hemoglobin, which binds oxygen, is already well saturated at 21% oxygen. I talked about 96% of those sites are already bound with oxygen in 21%. So what is 100% going to do? It might bind a little bit more, but there's not a whole lot more places for them to bind. It's already mostly bound. This is where the pressure comes in. So in a hyperbaric chamber, we simulate the pressure you feel under a certain amount of seawater. Water is very heavy. If you pick up a bucket of water, you got some big guns there. I know, John, it's not that heavy for you to pick up a bucket, but for somebody else like me, it's pretty heavy, right? So we know that heaviness is actually weight. Okay, it's a heaviness, it's pressure. So we can simulate the pressure of being in a certain amount of seawater, and that seawater pressure changes your physiology and drives more oxygen in circulation, not just on those red blood cells, but actually into the liquid of your bloodstream called your plasma. The plasma has very little oxygen at its sea level, but we can drive in up to 1200% or 12 times more oxygen that way. So as a result of all that oxygen coming in, you have an immediate infusion of all this oxygen. So what happens initially is if all this energy you can make all of a sudden, which is fantastic, especially if you have an acute issue, if you have acute trauma, you're getting all this oxygen to tissue and you're getting much more in so it can diffuse further into tissue. And as a result of that, you're going to get oxygen to tissue that may be at risk or maybe that damaged. Like when I was in trauma centers, we could see people with partial amputations, but if you got them into a hyperbaric chamber, you could save that limb because the downstream tissue that was injured, out down from the injury itself, could get oxygenated, even if the blood vessels weren't working as well, for example. So you have immediately decrease in inflammation as well. You have stem cells that get released. Stem cells are these baby cells in our body that can help you make new tissue. You have the immune system that gets revved up. It's an antimicrobial as well, so it helps kill bugs that do not like high oxygen environments. It helps with oxygen flow into tissue, as I described. It also helps with lymphatic flow or detoxification from tissue. And then over a long term, over like a protocol of hyperbaric therapy, when you're going in for multiple days, you can get what are called epigenetic changes or changes in your DNA expression so that you have decreased inflammation over the long term. You have new blood vessels and tissue over the long term. Those stem cells mature into cells that can continue to or can regenerate the tissue that may have been damaged. So you have all these things that are happening in a hyperbaric chamber. And so then you can really use it for anything that you can imagine, really, when it comes to anything that needs healing, anything that has inflammation, anything that needs stem cells, any infections that don't like high oxygen environments. Hyperbaric therapy may be helpful for.
It's fascinating stuff. So on the protocol side, you have patients doing this multiple days in a row. Could you explain a little bit on the typical protocol you see for different types of injuries or conditions? And then also, can we hit how safe HBOT is and whether there are
Yeah,
any potential risks or side effects of it?
yeah, yeah. So when it comes down to safety, hyperbaric therapy is extremely safe. It's been around a long time. There's different types of chambers available on the market. There are what are called mild units. These are units that are usually made of a soft kind of material. They go to less pressure, less oxygen, and they're really more for, excuse me, like neurocognitive optimization and day-to-day muscle recovery, your kind of biohacking strategies. Yeah, I'd say that the mild units are great for that, and they're very safe. There's very few reasons why you wouldn't want to go into one of those chambers. The medical units, there's a little bit more of a safety profile you want to think about. You're going to deeper pressures. You get more systemic optimization, and so these are most of the protocols have been developed using the deeper pressures. So it's something that you want to be thinking about. The major reasons why you don't want to go in if you have any major cardiopulmonary neurologic issues, in the sense if you have any congestive heart failure, if you have any history of severe lung disease, you wouldn't want to go into a hyperbaric chamber without supervision. And then if you have a history of seizures, you don't want to go into a chamber if they're uncontrolled, because hyperbaric therapy does decrease the seizure threshold, which means it does increase risk in people that do have a predilection to having seizures themselves. But I'm kind of answering your second
Yeah,
question before your
yeah, that's
first
fine.
question. But when it comes to protocols, it's really important to kind of delineate things in two ways. The first way is this an acute issue or is this a chronic issue? Okay, and if it's an acute issue, do not pass go. In most cases, hyperbaric therapy is going to help you heal faster. So this has been looked at in a number of different ways, but in like general, just basically surgical recovery. So somebody that gets hyperbaric therapy for a surgical procedure, whether it be a plastic surgery or a knee surgery, they're going to heal about 50% faster if they get into a hyperbaric chamber. But they don't need a huge amount of therapy because it's an acute trauma or acute stress on the body. And so the acute protocols are shorter. It can be anywhere as low as or as few as one treatment to as many as 10 to 20 treatments, kind of thing, depending on what's required. If it's a chronic issue, meaning this is an issue that's been ongoing for some period of time, usually at least 3 months, but oftentimes when I see them, they've been going on for much longer than that. When that's the case, you need longer protocols to see the benefit. And oftentimes it's not just about going into a hyperbaric chamber. It's really even more significantly important to optimize foundational biomarkers of health, vitamins, minerals, nutrients, gut health, neurotransmitters, hormones. All of those things are really important because what happens when you have a chronic injury is that oftentimes a lot of those processes get dysregulated or just don't work as well. You can't make energy as well. You can't detox as well. You have a lot of inflammation going on. Your gut gets toxic. Your hormones get all screwed up. Now, sometimes hyperbaric therapy can help fix some of that stuff. For example, I've had people with brain injuries with hormone dysregulation, and we get them into a hyperbaric chamber, and their hormones get better because we figured out that their brain gets better in the hyperbaric chamber, so their hormones improve. But that's not always the case. What I've found oftentimes is that it's not a great idea to run into a hyperbaric chamber if you have a chronic issue. And the first step really is to optimize your health for the like if you can for about 3 months ahead of time. That's when you know that you're going to be most effectively making energy, that you're most effectively going to be able to detox from the energy you make. And you can also add a lot of different types of other technologies and practices and supplements and things like that. But getting the foundation is really, really helpful. I've found that it's been dramatically transformative to my practice. And it's gotten me disinvited from hyperbaric conferences over the years, telling people to not go into hyperbaric chambers. But I feel like it's more important, obviously, to help people over the long term because and one of the things that I found early on, John, was that I would put people into the chamber when they were too sick, and they may get better, but they would always recur. Their symptoms would always recur, and they would just not sustainably get better. And sometimes they would never even get better; they would just get worse in the chamber. And oftentimes we'd stop hyperbaric treatment, and they would get back to the way they were before, but it wasn't beneficial to them, is what it was coming down to. So I always like to think about it. So there is the acute versus chronic.
Yeah.
Is this an acute issue or is it a chronic issue? And the second, and I was alluding to this on the protocol side with the chambers, is this something that can be done in a mild unit or is it something that can be done in a medical grade unit? And in the mild units, I'm thinking of neurologic things. I'm thinking of day-to-day operations. I'm thinking about biohacking types of protocols where you're stacking things together. The mild units are very good for that. That's like 1.3 soft chambers. It's the kind of one I have in my house. And then the deeper chambers, I'm thinking about people that have more chronic, more long-standing issues that require deeper pressures. I mean, ideally, you have access to all these pressures, of course, but I think for the most part, from a day-to-day operations perspective, the mild units can go a long way, and then you can always go to a facility that has deeper pressure capacity. There are people that have these at their home now, but in general, you go to a facility and you can find one pretty easily.
Would someone from suffering from MS, for example, be a better fit for the acute one or the chronic condition, the medical grade
MS is
unit?
interesting. So MS is a neurologic condition. It's also an autoimmune condition. It's likely related, as we know now. We've known this for decades, but the research has finally, I think, shown more consistently that this is likely a reactivation of Epstein-Barr virus that's causing a cross-reactivity in autoimmunity and then causing MS. So it again becomes one of those conditions where you don't want to immediately go into a hyperbaric chamber. You want to be thinking about how you're optimizing your health at the baseline level and working on inflammatory markers, working on your gut, working on hormones, working on your blood-brain barrier permeability and things, which is related to leaky blood vessels and leaky gut and things like that. So all of those things really play into it. And so this is not the kind of situation where I just like to throw supplements at people and put them in the chamber. I've had mixed I've had mixed responses from MS patients over the years, and oftentimes where I have had some good responses in people is in MS patients that are having acute flares. They can certainly get better faster in a hyperbaric chamber. Where I've had more mixed results is in MS patients that are uh, that are not in a flare, but preventing flares. And so that's been there's not a lot of great research, although there is a huge nonprofit organization in the UK that has so basically the UK has all these decommissioned huge hyperbaric chambers called multiplace chambers, and the MS societies run them in the UK. And there's people that have been using hyperbaric therapy for decades with significant improvements and stability of their disease using the chambers. And it's not so the other piece just to mention is that we're talking about acute versus chronic. We're talking about how many treatments you need, but in general, when you first start hyperbaric therapy, you're typically going in daily, like or 5 days a week for a period of time. And then over the long term, over longer term, you're not going in every day. You're going in maybe 3 times a week, maybe once a week. It depends on the protocol and depends on depending on what's needed, especially when you have an autoimmune type of presentation, these things aren't typically going away. So that's when like these sort of maintenance protocols might be helpful, where you're going in once or twice a week in perpetuity, just to keep inflammation and getting oxygenation to where you want it to be over time.
Who created these protocols, and what is you mentioned that when you were in medical school, the hyperbaric oxygen treatment was being used in the hospital. What is the current research look like behind HBOT, and where is it left to go in the coming years?
Yeah, so there's 14 indications that are currently covered by medical insurance in the US. Only 4 of those are really done outside the hospital. Diabetic foot ulcers. So patients with diabetic foot ulcers that aren't healing, they can go into hyperbaric chambers and heal up those ulcers, prevent amputations. In patients with radiation injury from cancer treatment. So these are patients that have gotten treatment with radiation for cancer, but have radiation side effects. These are not acute side effects. These are more longer term side effects that don't go away after 6 months or longer, or they develop after 6 months from the radiation exposure. I mean, hyperbaric therapy, as I was describing, rebuilds the scaffolding of tissue, as I like to say. It regenerates the tissue, repopulates it with stem cells, more blood vessels, decreased inflammation so that tissue works better. There's also patients with chronic bone infections that hyperbaric therapy is approved for. Sudden hearing loss, when patients lose hearing, suddenly this is a neurologic condition. We're not exactly sure why it happens, probably related to a viral infection, and also flaps and grafts and plastic surgery. So those are the ones that are covered by medical insurance. Outside the medical realm, which is where I mostly work, there's about 50 or so conditions, I would say,
Wow.
that have pretty good data. In Russia and China, there are 70 conditions that are approved for use inside of a hyperbaric treatment, a hyperbaric chamber. In most other countries, it's 14 or less, interestingly enough. The challenge with research in the hyperbaric field is that it's very difficult to have the gold standard of research types of trials called the randomized control study, because putting people in hyperbaric chambers is a significant environmental stimulus, no matter how you look at it. But I would argue that no real randomized control trials really exist, is what it comes down to anyway. We're not testing everybody for their gut microbiota. We're not we're not looking at people's circadian rhythms. We're not doing a whole lot with a lot of these kinds of studies. And so with the randomized control studies, and this is why the randomized control data changes every 10 years or so, because new populations of people having different types of ecosystems and things like that. But not to say that it can't be helpful in some ways, but just to take everything with a grain of salt is what it
Yeah.
comes down to. So, yeah, the field of hyperbaric therapy is really it's grown dramatically over the last several years because of a lot of interest related to COVID, actually, and related to just the work in the performance space. And I've been involved in protocols in the performance space since I've met you, John, and before in 2015. And this is my initial forays into the biohacking optimal performance world is how we can leverage these chambers to truly synergize, optimize, and accelerate healing. And so I created a company 3 or 4 years ago now called One Base Health. And what that company is doing is creating new technology that makes the chambers work better, faster, and safer. And so we have chambers that we're working with. We have technology. We have a phone application that's trying to make it safer for people to use these chambers at home. Because I find that more people are getting these things but don't know how to use them, for example, or going to facilities and don't know how to use, or the people that are running them have no real clue on the protocols and things that are coming out and what we're doing. And I've been on the forefront of this for many years. So when it comes down to protocols, I've developed my own over the years. I've certainly leveraged the research that's preceded me for decades, and we know the basics of when we think that things are going to be shifting, both from the acute setting and the more long-term setting when it comes to the treatment protocols as well.
Yeah, it's something that when you're talking about HBOT in like Western medicine for these insurance covered treatments versus what you use it for, what it's eligible for in countries like Russia and China. I think of something else like ketamine that is being used off label for like depression and anxiety. And I'm curious, with you being at the forefront of the space, using these types of practices for chronic conditions as well as for performance and biohacking. What other technologies are you interested in or seeing success with that have some level of research and validation in Western medicine, and then but are now being expanded in their use case for alternative healing?
Yeah, this all comes to me in my clinical practice in the sense that I'm always looking at what can I do before, during, and after hyperbaric therapy to truly optimize the experience and make people get better faster, or more completely. And ketamine is an interesting one you mentioned. We're working on some protocols where using ketamine prior to going into hyperbaric therapy is interesting because what happens with ketamine is that you get this sort of reset of your brain. Basically, your DMN goes offline, your default mode network goes offline. You can get some great therapy during that time, as we know, and then consolidating those changes and making them happen more robustly, we think can happen in like in a hyperbaric environment where you're helping with neuroplasticity, for example, getting more oxygen to the brain during that time. So I always think about the various types of therapies and practices that can benefit a lot from being under hyperbaric conditions. And then this could be anything also like physical therapy and occupational therapy, things that have been going we've had forever. But if you can stack that with hyperbaric therapy, you can see a benefit because you're increasing the potential of the brain to help with multitasking and also with neuroplasticity, as I mentioned. And so I always think about, there's a lot of other technologies out there these days and practices and supplements and things like that. I have a company that's been pretty focused on this one compound called methylene blue. And methylene blue has been around a long time as a compound that was the first drug registered with the FDA back in the 1890s, actually. But we now know it's a fantastic mitochondrial enhancer. It helps with energy production. It helps with antioxidant reserve. It helps with decreasing inflammation. So I've been using it in my patients with chronic inflammatory conditions, fibromyalgia, chronic fatigue, autoimmune conditions, otherwise, post-COVID patients, and or even during the time when COVID was more significant, and during COVID as well. And then I was combining it with the hyperbaric therapy protocols as well, and seeing amazing kinds of things with brain injury, with healing of various types of things faster as well. So I've been very interested in how you could use this particular compound, the methylene blue compound, in various types of protocols. And now there's multiple companies that are making it. My company was one of the first back in 2020 that was making a very easily accessible type of methylene blue that you could get over the counter, from our company and things like that. So, um, yeah, I think the psychedelic space in general too, as you were kind of alluding to with ketamine, is very interesting and very exciting. I think that the way to recalibrate the brain is not just physical. It has to be, I found out with a lot of my patients over the years, if you don't address the psychological components of things, they won't get better no matter how much you try. And I've had people that should have gotten better with hyperbaric treatment over the years didn't get better, or they didn't get better because they had these thought patterns, psychological loops, trauma in their past that needed to be addressed. And once you address those, that's when they get better, right? So I think I see a lot of benefit, a lot of potential in all of those things.
How about something like ozone therapy? I've heard about it a little bit, and I know I don't know how much research there has been around it.
Ozone's been around a long time. It's O3, so usually oxygen's with a two, but you have O3, so three oxygen molecules instead of two. And so ozone's a great anti-infective. So it's been used in various ways as an anti-infective. It's also an immune system modulator, so it helps with immune system function. So I do think it could be great in patients with, needing of those kinds of things, decrease inflammation, immune system modulation. So I have used it in those ways. I'm not an ozone doc, but I've used hyperbaric therapy in combination with ozone in people with chronic infections with some success over the years. You do have to worry about too much stress on the system, but in general, I'm a big fan of it used in those
Mm.
contexts.
Anything else we should be looking out for? I think you've mentioned that you use, um, that you've also created. It's crazy how many companies you have that you created one around tropes or stuff that you realize that patients can benefit from as well, in addition to the methylene blue.
Yeah, so the methylene blue comes in something
Oh,
called the
oh, the
troche,
troche.
which is yeah, yeah. So they're called buccal troches. They go between your upper cheek and gum, and they dissolve over about 15 to 30 minutes. And we have one specifically for focus. It's like kind of like your Adderall without the jitters and without all the terrible side effects. And we have one that's a mitochondrial optimizer purely, and that's methylene blue. And then we have one that's for calm relaxation that has some cannabinoids, CBD and CBG, along with kava and GABA, which is really great for anxiety, stress relief, calming down thoughts, and things like that. But the key with these products, though, John, was the idea that we were trying to create products that could help people right now while they're on the path to optimizing their health. And so the concierge practice that I run, Health Optimization Medicine, is a nonprofit, as I said, and the for-profit arm is this company called Troscriptions, TRO, and the word prescriptions, troche and prescriptions mashed up into Troscriptions, and it's that as prescription grade as possible to help people along their path to optimize. And we came to methylene blue first because it's such a significant supporter to the system. So we use a lot of that. I use a lot of that in clinical practice. Our focus product is called blue cannatine. This has a combination of methylene blue, CBD, and then caffeine and nicotine.
Wow.
So people get scared about nicotine outside of the biohacking realm, but nicotine is a fantastic cognitive enhancer, and it's in small doses, which we use in the product. It's a great product. And it's not addictive, and it gives you about 3 to 5 hours of superior focus, flow, verbal fluidity, those kinds of things. And so great for jet lag, great for concentration, as a great alternative for some of the other stuff without a crash or withdrawal.
Why is the form factor this? Is it called a troche? Why?
Troche, yeah, yeah.
Why
Troche,
that
yeah.
versus
Or
a pill or something else?
yeah, because the mucosa up here is highly vascular, and so it goes directly in circulation to your brain, so it works faster. And also, when you swallow your supplements, they get detoxified or deactivated in your liver with something called first pass metabolism. And so, like your average supplement will be about 20 to 40% bioavailable, which means that only about 20 to 40% of what you're taking in a milligram dosage or gram dosage is actually getting into the body. But when you take things up here at Buckley, it's almost 100% bioavailable. So you're bypassing all of that and getting it directly in the system. So that's the other reason. So it's faster acting. It's more focused on the brain as well because you have brain circulation, and it's also not getting degraded by your liver or your stomach.
How do you feel? This is becoming like a John's curiosity questions based off of just like little things I've heard through the grapevine. Uh, Kratom. I've heard of kratom being popularized in sort of the wellness world or the biohacking world as a way to improve energy, increase energy, and increase focus. But then I've also heard some like warnings on it because I think it's also used in opioid people that are ex-opioid
Yeah.
users as a way to relieve some of those cravings and symptoms.
Yeah, so yeah, kratom's been around a long time. It's a plant from Southeast Asia. It's an opioid agonist, so it works on the opioid receptors. At low doses, it has been shown to increase focus, memory, those kinds of things too. That's why it's used in that way. And on higher doses, it's been used as an opioid alternative. It's actually pretty safe overall as an opioid alternative. It's the real issue is just making sure you get good quality stuff, and it's not contaminated. It's not regulated very well, and so that's with some difficulty. But it was on the list to get scheduled a couple of years ago by the DEA, so getting you know put on the illegal list, but it hasn't, and it was because a lot of people have used it to get off opioids. So I think it has to be used with some caution, but I do think it could be used in a way to help with people that have opioid addiction and helping them get off of that and slowly. But I also think it could help in various ways and otherwise, and sort of in the energy and the biohacking space too, just with caution.
You mentioned that you are now in Colorado, and you mentioned in LA, you're getting like 20% oxygen in the air you breathe. Uh, is it how
Yeah.
is it different where you are? Is it double that? Is it triple that? Is there a way to measure it?
Yeah, so in at sea level, you get 21% oxygen, so where you are in LA. Where I am, I'm getting about 16% oxygen in the air that I'm breathing here. But our body has these mechanisms that this is why you have all the people that have these endurance races that they all train at altitude. Because what happens when you train at altitude is that you release some hormones that increase the number of red blood cells that are in circulation. As a result of that, you have more oxygen carrying capacity. But as I was alluding to, you don't need to do that. In a hyperbaric chamber, you're driving more oxygen in circulation in the plasma or the liquid. So you don't need more red blood cells to carry oxygen. So it's kind of a hack in that way. So in some athletes I've worked with, we try to see if we can sort of pair hyperbaric treatment with the athletic pursuit in combination. So get out of the chamber, go exercise because your aerobic capacity will go up for a period of time for about 30 minutes to an hour. So you
Cool.
can do these kinds of things with training and things. Yeah. So, yeah, there's all different things. And so I consult with people all over the world in my own clinical practice. I have a virtual practice that's based virtually, I guess. I'm in Colorado, but I see people, work with people all over the world. I work with clinics all over the world that are looking to integrate hyperbaric therapy into their own clinical practices. If they have other technologies, if they're practitioners that have various types of therapies that they use. So I do a lot of that. And I also obviously work as, uh, I also do a lot of work with my own companies to spread the word about the things that we're doing.
Dr. Scott, you're a baller. Anything else you want to talk about and mention? Anything you're experimenting with or trying yourself right now?
Well, just to mention, so my hyperbaric company is called One
Yeah.
Base Health, onebasehealth.com, and we're on Instagram there. And we have tools, technologies, and practices all around the hyperbaric treatment itself, the hyperbaric, the chamber. And then we're working on various types of technologies to make it better. My company, Troscriptions, TRO Scriptions on Instagram at Troscriptions, Troscriptions.com. We have a bunch of products there that you guys can check out. New ones coming out all the time. We have a professional line that we're working on as well to come out with for specifically for clinicians. I do a lot of clinical training and practitioner education and things like that. You can find us at a lot of conferences uh, because of that. And personally, what am I working on? So right now, I mean, currently are testing a whole bunch of new products for my company. So we've been testing a product for sleep. We've been testing a product for energy. We've been testing a product for pain. So
When you
I've
say
been in the
testing,
midst of testing a
are
lot
you
of those kinds
testing
of
them on yourself? Do you test them with
yeah,
patients?
yeah. Testing on ourselves first, and then we test on them. Then we clinically test it with the people that we work with in clinical practice. And yeah, so that's what I've been working on. Other than trying to get enough sleep and yeah, I'm trying to, sporadically get some time to myself in the midst of my 4 children, dog, and wife as well, so,
Amazing. Amazing. Well,
yeah.
Dr. Scott, it's been such a pleasure chatting in this format after we've kept in touch over the years. You're a wealth of knowledge,
Yeah,
and I look forward to keeping the conversations going. And thank you for being here. And hopefully, we could do a round two sometime.
likewise, John. It's been a pleasure keeping in touch all these years too, and let's keep it up one time when I'm in LA at some point.
Yeah, or I'd
We'll get
rather come
together
meet
for
you
sure.
in the 16% mountaintops and maybe
We'll go
yeah,
skiing.
yeah, for sure.
All right, man. It was good talking.